Now, COVID cases have shown a dip in several states and metros due to fewer testing over the weekend. Mumbai saw its cases dip from 19,000 to 13,648 in the last 24 hours. Maharashtra reported 33,470 new COVID cases in the last 24 hours. Meanwhile, West Bengal also, after recording an all-time high case count of 24,000, saw its number dip to 19,286 in the last 24 hours. In fact, Delhi's numbers also dropped from 22,000 cases to 19,166 cases. Delhi's Disaster Management Authority has decided not to impose a lockdown in the state, but has also ordered the closure of restaurants and bars, much to the disappointment of the restaurant owners. Meanwhile, if we look at Tamil Nadu, it has in fact extended all the restrictions in the state till the end of January in view of the third wave. My colleague Sandhya now joins me live on the broadcast. Sandhya, very good morning. Now, thankfully, the numbers, are showing a slight dip as far as Mumbai and the state of Maharashtra is concerned. Considering this is the worst hit state that we are talking about, this can be a respite. However, this is also to do with lesser testing.
Which are in picture and which should be considered while actually declaring that this should be seen as a relief. First, these are weekend numbers. So as you rightly mentioned that as a result, there is an effect on the number of tests, which actually has dropped. But when we have to understand the seriousness of the situation, we also compare positivity rate of, two specific dates or two specific timelines. So talking about the positivity rate, this is the ratio of how many tests were done and out of those tests, how many people were found positive. So if I draw a parallel between yesterday, as in 9th of January and 10th of January, so the positivity rate on 9th of January was 28% and yesterday it was 23%. So there is some relief on that front, that there is a drop in positivity rate, but also, as I said, that it was weekend, so weekend factor will also have to be considered. And apart from that, if we talk about deaths also, there is a slight relief. On 9th of January, 7 deaths were reported, and yesterday 5 deaths were reported. If we talk about rest of the factors, if we have to understand how's the situation in the city, those factors remain the same. Because out of the number of patients, out of the total patients, the percentage of asymptomatic patients was 82 on 9th of January and 83 yesterday. So it's more or less the same, not a massive drop or for that matter, a hike in that particular factor. Apart from that, if I also talk about the beds occupied, that also remains more or less the same, because on 9th of January it was 21.3% and on 10th of January it was 21%. So this is the situation in Mumbai. But before, as I mentioned, that before we or anybody declares it as a relief or that the situation is improved, that one thing which I said has to be considered is the weekend factor. That is something which has to be considered, and these numbers also in no way or manner express that or explain or give a hint that anybody should even think of lowering their guard, because as of now, yes, the numbers which were recorded
Absolutely.
yesterday are less as compared to what it was, but the situation is still grim.
Right. Thank you so much, Sandhya, for joining us with updates from Mumbai. Let's also shift focus to Delhi. We have been mentioning that Delhi also has recorded a drop in numbers from the whopping 22,000 to 19,166 cases. And the Disaster Management Authority has also imposed fresh curbs, which requires the closure of restaurants and bars. Now, this has also led to absolute disappointment of the restaurant owners there. So we are supposed to be seeing what exactly is going to happen as far as the curbs and the fresh curbs in the capital and other places are concerned. But meanwhile, this is what is come as a welcome respite, that the case tally, in fact the surge that we were talking about, has shown a slight dip. But as Sandhya was also mentioning, that this should not be used to let our guard down, because this is also a result of lesser testing.